Welcome to Connecting Hope with the Mississippi Department of Human Services. I'm your host, Mark Jones, Communications Officer for MDHS. In today's episode, we will be discussing the work and the business of hope with our Executive Director, Bob Anderson. Mr. Anderson, welcome. We're now in March 2024, 4 years into you being appointed the Executive Director of MDHS. Let's start by talking about those first 4 years under your leadership.
All right. Well, it's been pretty busy. We had a lot of work when we first got here, just kind of putting in place a lot of internal controls that were not here. And then the next couple of years, we've been working on trying to reach out to the families that we serve.
So this initial mission hasn't just been fixing what was wrong from the compliance and following our rules, but moving the agency. You speak a lot about moving the agency forward.
Absolutely. Yeah, the first year and a half or 2 years we were in Operation Restore Trust. So we were focused on compliance and integrity. But the agency's always been focused on moving toward excellence. And moving this agency towards excellence means better serving our clients, better understanding the needs of our clients, and better equipping our staff to meet those needs. And so we've been moving forward and moving toward excellence. As I tell folks, excellence is it's a journey. It's not a destination. So we continue on that journey toward excellence even now.
So within the time that we've been together working here at MDHS, the staff and as well as the public may have heard you use the phrase that MDHS, as a part of not only Operation Restore Trust, but doing more in our communities, that MDHS is in the hope business. What do you mean by hope business?
Good question, Mark. And what I mean when I say we're in the hope business is, we're in the business of bringing hope to families whom we encounter in a pretty hopeless place in their lives. They're in chaos, they're in confusion, they're wondering where their next meal's coming from, where their next rent payment's coming from. They don't have a lot of hope. And because of all the programs that we have at our disposal, we have SNAP, we have TANF, we have the low-income home energy assistance program, we have other community services programs that will weatherize homes. We have aging assistance. All of those programs are designed to bring hope into the families that we encounter along the way and who come to our county offices and also to our state office looking for some hope.
So one of the things I believe you've identified within the process of delivering those programs that you mentioned, SNAP, LIHEAP, you've undertaken a few items, and we'll touch on specific things later, like our Success Project, and a little bit of a teaser there. But what does it mean for our clients? You've identified that many times our applications, you have to go through several different applications just to touch one or two programs.
Yeah, we put a tremendous burden on the families we serve. Just to complete a SNAP application, the estimate of the amount of time a family has to invest is about 2 hours just for that SNAP application. Now, if that's a mom with children, that means she's got to make arrangements for child care. She's got to get down to the county office. She's got to hope that she brings all of the documents that are required with her, because if she doesn't, she may have to come back for another visit. And so that application process is really burdensome, and we are looking forward to the day when we can make that much less burdensome. That first 2 hours for the SNAP application, that doesn't cover a TANF application. If a family needs TANF assistance, then they have to start all over again and do another application. And if they need a child care voucher, then they have another 2 hours of time. And families that are in need, the one thing they don't have is the luxury of time. They don't have 2 hours here and 2 hours there and 2 hours the next day. Some of them are making the best effort they can to get to our office one time, and we should make it easy for them to apply for benefits instead of what we're facing right now because of the old, antiquated systems that we have in place. we put a heavy burden on our clients to just interact with us in the form of an application.
I like where you mentioned that 5 to 10, 12 hours that someone would have to put in to receive assistance through MDHS. Many times you talk about that process and allowing clients to also know that we are listening. How does the agency come about in listening to its clients and also making sure that we're adjusting to meet their needs and giving them time back?
Well, I mean, we have to be attentive to the needs, and as clients tell us what they're dealing with. If a mom comes and she brings her children, we know she needs child care. But we need to observe that. We need to hear that. We need to be paying attention. And we are also trying to put some better tools in the hands of our clients so that they can better serve the needs of those families that come to us. You mentioned the S.U.C.C.E.S.S project, and I'll go ahead and just talk a minute about that. We presently use old computers that are based primarily on batch processing. So we take the information in, we process the batch of information overnight. Nobody thinks of computing like that these days. Everybody wants to do things in real time. Well, the S.U.C.C.E.S.S project will allow us to process applications using cloud-based computing in real time. That's a huge, huge improvement in the delivery of services to our clients, because they're here in the office across the table from one of our case managers, and we can process that application. We actually visited a neighboring state recently and looked at their updated systems. They can take a SNAP application in about 18 minutes versus that 2 hours that we take right now. That's almost 2 hours of time we're giving back to that family, and we're giving it back to our staff so they can focus on getting the benefits out to that family that came in and spent that 18 minutes with us. So that's where we're headed. That's part of this journey forward toward excellence. When we have 21st century tools at our disposal to do 21st century work, we can be much more responsive to our clients' needs.
Mr. Anderson, over the past couple of years, you've instituted some initiatives to make sure that we are not only connecting our clients, but also connecting our employees to training that helps with retention as well as upward mobility. Would you like to share some of those initiatives?
Oh, absolutely. Yeah, one of the things we have done, and I tell all the new employees who come to this agency that we're going to invest in them from the first day they're here. They're some of the most important assets of this agency, the people who are this agency. And so we invest in training and teaching them how better to do their jobs. One of the things we're in the middle of right now is a multi-unit leadership development program for all of our division directors, designed to teach them better how to be leaders, but also to give them a chance to build network with each other, to build relationship, to interact with each other. Some of them had not even met each other before they began their leadership development. And so now they have built relationships over the last 4 or 5 months, and they will be able to interact more freely, more comfortably, and more regularly so that they can better serve the populations that their division focuses on, and also identify needs from those other divisions that they now know more about.
Obviously, training the staff, connect to clients, but also to each other. It has a long-term benefit of also making sure that we have consistency in that service delivery and case management process. You've also done a few things within the agency to inform how we hire and train people in that HOPE business, not just with the trainings, but maybe the career ladder. that we instituted.
Yeah, the career ladder has been a great advance for us. You know, in years past, in state government, the only way you could really give an employee a compensation increase was to find another job, move them up into another job. Well, that doesn't make sense. If we have great caseworkers, we want to keep them doing great casework. If we have great investigators, we want them to stay in the investigative work. If we have social workers who are working with youth services and making a difference in the lives of juveniles, we want them to be able to take that experience and use it year over year over year. Well, what the career ladder plans that we got approved through the State Personnel Board do is they allow us to look at the experience that an employee as a caseworker, as a social worker, as an investigator, look at the experience they've accumulated and the competencies. You know, every year you work in a job, you're going to be learning more about how to do that job better. And so every couple of years, we check up with those employees. We look at the new competencies that they have gained, and we can move them up the ladder to a new salary level. And our pay steps, our career ladder, will allow us to make steps for about 10 years, and employees can move to the top of the ladder and see an increase in income every couple of years. And that helps us bring longevity. We have a lot of people in this agency who've been here for a long time, but we want the newest ones who are joining us tomorrow to want to spend their careers here as well.
This is more of a yes/no question, but feel free to expound upon it. All of this comes back to the idea of building our hope business, affecting our clients and our employees.
Absolutely. You know, just as much as we're in the hope business in serving our clients, I want the employees who come to this agency, who come to work here every day, to be hopeful about what they're going to do, be hopeful about the difference they're going to make in families once they get here. And the ones who've been with us 10, 20, 30 years, you can see it in their work. They love to serve families. But we want every new employee to have that same opportunity. As I've told some of the most recent arrivals, we want you to be able to spend a career with MDHS. But to do that, we need to invest in you and allow you to reach your potential, because every employee who reaches her potential with this agency becomes a much more valuable asset to us and to every family that they serve with those tools and those skills that they've acquired.
So let's segue. You've already mentioned one of the specific projects, our Success Project, and we'll go a little bit more into detail on that. But what are some of the other technologies that we are utilizing to build the context of hope at MDHS?
Yeah, one of the things I hope and I believe is really hopeful for our clients right now is when they go to their computer and they type in www.mdhs.ms.gov, they see a brand new website. They see a much friendlier website. They see a much more manageable and easy to navigate website that has right there on the landing page, I need help with, and they just fill in the blank about what they need help with. And they can get help with food, they can get help with finances, they can get help with utilities, they can get help with elderly adults, they can help with everything and anything that we as an agency offer. And you and your team spent a good amount of time, Mark, making that new website be available to our clients. You know, everybody works through their phones these days. Everybody has that smartphone, and our website is available both on a desktop and on a smartphone, and that is a major improvement, and I'm sure has brought a lot of hope to the folks who access our agency through just the website. That's a major improvement.
So one piece that you mentioned were the I need help with pages, or as we internally love to call them, our basket pages.
Yeah.
And those kind of grew out of your vision of talking about those baskets that you receive at Christmas and Thanksgiving that you give to sometimes needy families or just families. Talk a little bit about that concept.
Yeah, I like to think of all these benefits that we have are one big giant basket of benefits. I mean, there might be a little bit of respite care for an elderly adult here in this edge of the basket. There's a little bit of food here in the corner over here. There's a child care voucher. There's help for your utilities, all within that big giant basket. All of the services that we have to offer are available to every family. If they have a need from one of those programs that we serve, we can take stuff out of our basket and share it with those families and make it available to them. And we should, when a family comes to see us, our basket should be empty when we get through serving them, and their basket should be full because we have delivered all of the services that we have available to them to meet the needs that they have.
Sounds like you're delivering a good amount of hope in different ways to our clients. One of the projects that I've also been involved with on a planning side is the hope business of, if you don't know where you're going, then you'll never have, and you don't have a roadmap to get there, and you don't have the measurables to determine if you're being effective. One of the things you've also brought in is a strategic plan, and we're in that process as well.
Yeah, absolutely. You know, when I arrived here 4 years ago, I couldn't find a strategic plan, just like I couldn't find a compliance officer in the whole agency. I asked for a strategic plan. Now, we have a plan that we submit as a part of our budget process, but it didn't have really much to do with the work of the agency. And we worked with a consultant a year and a half ago and spent a lot of time developing a true 5-year strategic plan. And as a part of that plan, every one of those programmatic agencies that we've talked about, aging, youth services, economic assistance, community services, all of those are developing monthly snapshots, if you will, dashboards of the work that they're doing and of the work that they need to do in order to serve the families in their particular population so that we can look at the difference that we're making in families. You know, we don't know where we're failing until we look at the actual dashboard, the snapshot of the work that we've been doing. And then we see, well, we didn't serve very many people in this area. We need to emphasize that next week, next month, next year. Or we're serving a lot of people in for example, childcare right now. We're exploding in the childcare business. From May of last year until last month, the number of vouchers we were handling went from 24,000 to 40,000. Wow. That's an amazing increase. But we've got to be making some planning about how we are going to finance that continued growth. We're talking to our friends at the legislature. They know of the needs, but we want to be able to continue to deliver the hope to families that they can have child care provided for by having that voucher. And so we are going to continue to be looking at, through their strategic plan, all right, what's the next plan? What's the next alternative? What's the next avenue for finding additional support for our child care program, for example?
So you already brought up earlier in our first questions, the Success Project. We now talked about the website and the strategic plan. How will all three of those, especially the new website and the strategic plan, help us move forward? And let's go a little bit deeper into what the Success Project will provide us going forward.
Yeah, well, the website and the strategic plan are kind of steps 1 and 2, I think, of getting us ready for the Success Project. You know, the Success Project is updating all of our client-related systems and software so that we can better serve our clients. And so what we're going to do is look at every system, whether it's our TANF or our SNAP system or our child care or our child support, and look at how we can update that from these old, DOS-based batch processes to real-time cloud-based computing. And we're going to be doing design and development of taking 4 eligibility platforms, which is what we have right now. We have SNAP, TANF, child care, and child support, completely independent. They don't even talk to each other. And we're going to integrate those into one system, and a system that is much more nimble, that is modular, so that when something gets outdated, we just replace the module. We don't have to replace the whole system. And the new S.U.C.C.E.S.S integrated cloud-based system will allow us then to, as I said earlier, to perform 21st century work with 21st century tools, and give us a savings of time for our clients and for us, and allow us also, back to that strategic plan, once the S.U.C.C.E.S.S project creates all of these new systems, we'll be able to more accurately track the work we're doing, and to continuous improvement. You know, we have a external affairs office that looks at processes regularly to see what are some continuous improvement cycles that we need to be involved in. Well, with the S.U.C.C.E.S.S project, we will have access to continuous improvement ideas on an ongoing, regular basis, much better than what we have right now.
So I'm seeing some consistent elements here about the currency that may come along with being in the hope business. Number one is time.
Yeah.
Number two is the ability of our clients to stay engaged with their families because we're giving them back more time, or valuing their needs to connect to multiple programs.
Right.
So within that, one of the ways as we change technology, we also need to change the way that we are connecting into those communities across the state. You've been very forthcoming about your desire to be transparent with this agency, to be willing to have asked and answer tough questions.
Right.
So there's some things that you are bringing to our agency to start reaching into communities. They're not one-offs, but it's the beginning touch point. So let's talk a little bit about the things that MDHS is doing to connect the communities on the ground level.
Well, one of the things we've been looking at, and we're going to continue to look at, is going out into the community and doing town hall events with the community, stepping into the community and saying, here we are, MDHS is available, ask us any question, bring your problem to us, and let us hear your problem so we can work the problem. You know, we talked a minute ago about paying attention to our clients, and by getting into the community and letting folks have access to us, there are folks who are going to get help that wouldn't feel comfortable. Some of them still don't feel comfortable coming to our office, but they might come to a community event like a town hall. And we're probably going to be looking at doing some, joining in with some ongoing community events and just having a presence at places where people are already gathering. You know, we want people to think about MDHS along the way so that they can stop for a moment, figure out where they can get some of that hope and help. You know, the main objective of our providing hope is to get people past that hopeless state and looking forward looking. You know, when you're trying to sort out where your next meal is coming from, it's hard to be forward looking. It's hard to be hopeful. When you're trying to figure out if you have provision for your child to be cared for while you're trying to work, it's hard to think about going to work. It's hard to think about looking for work. But once you have some help, then you're hopeful about moving forward and moving into, we want every family we serve to have the opportunity to reach economic stability, and then to move forward from economic stability to sustainability, and to have that hope that things are going to be better for them next week, next month, next year than they are right now.
As we move forward, obviously trying to connect to our clients, but also through the town halls and community events, connecting to leaders and other partnerships that may strengthen the work that we do on the ground. How are we doing to reach them as well?
Well, we're letting everybody know that we're available, we're available to be a part of any event. We're using social media channels. We're using our website. Our new website, I think, is a big part of that. And we take advantage of conventions. We participated in the statewide supervisors convention recently. We are participating in other public events like that in order to just let anybody across the state know that they can connect with MDHS and that we're here available to provide them with those services that are in that basket of benefits that we have.
So, Mr. Anderson, after we've talked about our town halls, community events, attending conferences, a lot of that comes back into the idea that we want to engage in communities, but without the data, as a communications professional, I'll tell you, without the data or the information to communicate, it becomes difficult because we want to get that message as close to the street address in which our clients and our partners are living. One of the things we added onto the website was an automation for our partners to go to our procurement page. Strategic partnerships are really what are going to drive us closer into local communities to help affect change for our clients. So one of the things they can do is go to our procurement page at mdhs.ms.gov and register with a single click to share their email. And every time we update that page, they will receive an email saying there's a new partnership opportunity out there. How critical is the development of those partnerships going to be?
Oh, I mean, those are essential to our ability to succeed in what we're doing. I mean, we can't do everything ourselves. We need partners. For example, I talked about the low-income home energy assistance program. We work with the community action agencies. There are about 14 to 15 of them across the state. They actually administer that program through their local offices. We do the funding. We're the pass-through entity where the money comes to us from the federal authorities through the Department of Energy, for example. But they're the boots on the ground for us. Our sub-grantees in the TANF program, we do programs like Parenthood Initiative, teaching parents how to be parents, new parents, how to be parents. We do after-school programs and activities. Well, we can't do all of those ourselves, so we rely on partners all across the state, whether they be a local church or a statewide organization like a Canopy or the Boys and Girls Clubs alliances. They are our boots on the ground in a lot of places to help us administer the programs. We fund them, but they make them happen. Our partners they work hand in glove with us to make sure that we connect with every family that we can, whether they're in Itawamba County or Issaquena County or Walthall or Jackson County, wherever they are in the state, that we can connect with them. Now, you mentioned procurement. That means from time to time we have to take stock of where we are not reaching people in the state and issue procurements, issue an RFP, a request for proposals, looking for new partners to help us fill the gaps in those areas where we're not reaching people. And we will continue to do that. We'll be evaluating that later this year, looking at places where we need to have partners and offering the opportunity for nonprofits and other entities to partner with us. We have a great relationship with the community colleges. They work with us both in the child care area, and they work with us in workforce development. And they provide services that we couldn't provide ourselves. And they are part and parcel of our ability. They're essential to our ability to deliver that hope because they, as I say, they are boots on the ground in a lot of places where we don't have staff who can place people in jobs, who can train people for jobs, who can train child care workers about early childhood development. We're not in the education business. But we need those child care providers to be educated about the development of a child's brain from 1 to 5 so that they can be offering opportunities to let that child have the most robust learning opportunity, even in a daycare setting, so that they're not just sitting in a room, but they're actually having a learning experience in those daycare and child care centers.
So as we close this episode of Connecting Hope, congratulations on 4 years at the Mississippi Department of Human Services. It's a pleasure working and hearing this vision every day. If we were to put a crystal ball, in this case a microphone ball in front of you, and you prognosticated over what the next 4 years are going to deliver at the Mississippi Department of Human Services, what would your hope be?
So if I'm looking in a crystal ball, I think 4 years from now, definitely we will have completed all the work of the S.U.C.C.E.S.S project. In fact, we have a 2.5 year timeline. We're hoping to finish in 2.5 years, certainly by 4 years. We will have learned to lean into the strategic plan, and these dashboards every month will just be a matter of second nature to us. We'll be leaning on those every month. We serve a large number of families with child care. I'm hoping we can find the way, and looking in the crystal ball, I believe 4 years from now we will have determined where that funding needs to come from so we can continue to serve 40,000 and more families with child care vouchers. We continue to literally put food on the table through the SNAP program, and I think 4 years from now that will still be a significant part of the work that we do. But the one thing I hope for the most is that we will have cracked the code about making our interaction with our clients easier, simpler, shorter, and more complete, so that a half hour of their time will allow them to accomplish what it now takes a day or more of their time. And that will give those families back their time. It will give our employees back their time to work on delivering those benefits out the door. And all of us, I'm looking forward to 4 years from now when all of us feel a whole lot more hopeful about how quickly and how nimbly and how completely we can serve the families who come to us each and every day.
Thank you for sharing with us about your vision of hope. Hope not only for this agency, but for the people of Mississippi that we serve. Thank you for being here.
My pleasure.
Thank you for joining us in this episode of Connecting Hope with our Executive Director, Mr. Bob Anderson. We look forward to seeing you on future episodes as we share the mission and work of the Mississippi Department of Human Services. Thank you.